I think the device companies in general, if they want to get FDA approval so they can commercialize their devices, they virtually have to go through a trial. It's part of the FDA approval, right? Safe and effective. And even if they make a minor modification, their device compared to another device that's already on the market, the 3 device companies so far that have FDA approval that I'm aware of have all had to do a clinical trial. So Medtronic did the first one, Abbott did another one, and now, of course, Boston Scientific did this one. They did have, a unique system in the sense that they have multiple current sources for each of the contacts that are on the lead, whereas every other device out there is a single current source. So, we always debated this. When we first got these devices years ago with, Medtronic, the first group to put it out, it was voltage controlled, not current controlled, and it was a single source. So if the resistance around the contact we are actually activating and initiating the current from, if the impedance changes, then the amount of current flow changes. So it may vary based on the resistance around the electrode. Some people have shown how that can change over time. Usually the most changes are, in the first couple hours, but sometimes you can see those changes over a longer period. So let's say I set your stimulator at a certain level, and that gives you good control, but all of a sudden the resistance around the electrode increases over time. You get less current delivered, and then your symptoms may start to come back. And then you're going to come back and see me, and I'm going to need to adjust it again. With constant current device, the nice thing about that is that you can just set the current and you're going to get that amount of current no matter what the resistance is. Now, there are other constant current devices out there now, but this was one of the first groups that actually did it. And the fact that they can control the amount of current that goes across each contact. And in this particular device, they had 8 contacts. There's something new out there as well called a segmented lead now, which actually has 8 contacts, but it's set up so that it's one circular contact, like metal circle. And then there's 3 segments on the next one, 3 segments on the next one, and then 1 on the bottom one. Call it a 1-3-3-1. Boston has that device now, but that's not what the trial was. The trial was with 8 contacts, one stacked on top of the other. And again, the benefit here was that we could put as much or a little current across each contact. And the idea then is instead of, if you stimulate across one contact, you get a ball of current. But with this, what you can do is you can actually make the ball as big or as small as you want to. So that was nice, because you might have a contact that's really near an area that you don't want a very big ball of current. You want just a little bit, because you can kind of fine tune it. And then you could turn on a little bit of current and get a small ball. And then just above that, the contact could be a little bit bigger. And maybe the one above that, maybe make a little bit smaller. Or you combine the two, right? Stimulate across the two. You get a lot of options in terms of shaping the current field. The structures we put them in are not, they're not like a big circle. They have a geometric shape. And then wherever your lead ends up, you may want like a smaller ball or a bigger ball in different places. So it gives you that flexibility. And now that they have this new 1-3-3-1 out, they and Abbott both have this lead. But now Boston has the ability to put current across a segment in one direction, rather than put it in one of those 8 contacts, which is just going to be a ball up and down. Now they can shift it in different directions. This study was pretty much 8 contacts, one on top of the other, and you can control how much current through each contact. That was the advantage.